is Cheryl Linden, and I'm a counselor at the Shepherd Center in Atlanta, Georgia. The Shepherd Center is a rehabilitation hospital working with people with spinal cord injury and brain injury. My role as a counselor is to help people in dealing with these changes in their lives. Recently, we started a program where we went into the school systems in order to teach people about spinal cord injury and brain injury. And our goal was to encompass 3 different areas. We wanted to give you exposure to people with spinal cord injury and brain injury and how they live their lives after this. We wanted to give you an idea of the different kinds of professionals who work with people with spinal cord and brain injury. And we wanted to give you ideas on what you could do in order to be safe and prevent these injuries from happening to yourself. So with this program we started, we realized that we weren't able to go out into the entire country to bring these ideas to people, so we came up with this video in order to bring to you that information. So sit back and enjoy and learn what you can about spinal cord injury and brain injury.
Okay, hey guys, how many of you guys know somebody with a disability? A lot. Okay, how many of those people use a wheelchair? How many of those people are in your family? Awesome. You probably could teach us. Really? Okay, my name is Cheryl Linden, and I'm a counselor that works at the Shepherd Center. I've been there for about 25 years now. Started out as an occupational therapist, and I'll let our OT here talk about what that is. But part of my job is to help people kind of get through this whole thing that just happened to them just like this. Because if you think about it, what are some of your favorite things to do? Yell out. Basketball? Soccer? Cheerleading? Lacrosse? Don't understand that game at all. I have no idea. Watched the game last week, don't understand it. What else? Cosmetics? Awesome. Is that what you want to do? I'll talk to you after. Come do my hair. So look at all these things that you guys are talking about, very physical things to do, right? What if tomorrow you woke up and you couldn't ever do them? Would you be sad? Mad? It would be hard, wouldn't it? So one of the things that we wanted to do in this class that you guys have been taking is talk about, from people who live that every day and people who have found ways to do some of those things or found things of other interest to talk about, so that you guys can have a more real experience than just out of a book. So what we're going to do is, you see people spaced out here. Some of these people have an obvious disability, and there's a couple people up here that you might not know have one. And then the rest of everybody else is staff, and they're going to talk to you a little bit about what it is they do, and then each of our former patients is going to tell you their story. So be thinking of questions that you guys have, because we're going to let you ask whatever. Can they ask you guys anything? They can ask you can ask them anything you want. No. Okay, you might not respond, but you can ask them anything, okay?
Hi guys, I'm Olivia. I'm a nurse. I have the best job ever. Nurses can do anything from deliver babies to work in an ER, but in rehab, our job is a little bit different. We're focusing always as nurses on the medical portion of an injury. So we look at physically, how well are you, medications, saving your life if you're very critically ill, breathing, making sure that your body stays healthy enough to do rehab. I do a little bit of what everybody here does, so a piece of their job is also part of my job. So I do a little bit of case management, therapy follow-up, rec stuff, and counseling and teaching. The biggest part of my job is teaching family members how to care for their loved one after their injury. So making sure that when the patient goes home, they can be independent, either by themselves or with the help of their family, or if something was to happen to our patient, that their family members knew how to step in and when to step in. The best part about my job, hands down though, is getting to know the patients and the families and making relationships that can last a lifetime.
My name is Hannah, and I'm the speech language pathologist at Shepherd, and I have been at Shepherd for 6 years. I've been a speech pathologist for about 8 years, and I get to do a lot of really cool stuff with patients. So sometimes patients, after they're injured, are not able to eat normal food. like you and I would be able to eat. Sometimes they can only drink things. Sometimes they can't drink anything. Sometimes we have to kind of make their food like it's baby food in order for it to be safe for them to swallow, because it doesn't always go down the right pipe. So we want the food to go down your food tube. Well, sometimes it goes down the pipe that goes to your lungs, and it can make you really sick. So I work with people on getting them able to start eating normal food like you and I eat every day. Sometimes after an injury, people also have trouble with their thinking skills. So sometimes they can't remember things the way they used to be able to, or they can't think of the words that they want to say. So I help with those types of things as well. And then also, sometimes people, after an injury, have trouble breathing on their own, and they need the help of a ventilator. And so I help people be able to talk when they're using a ventilator to help them breathe. And sometimes people have had some kind of injury to their voice box, and so their voices don't sound the same. And so when that happens, I help people get their voices back as well. So I get to do a lot of really cool stuff as a speech pathologist.
Hello, my name is Billy Wilkerson. I'm a singer-songwriter, and 2 years ago I was a patient at Shepherd because on July 31st, 2011, I was hit by a drunk driver. I was in a coma for a week. I was in ICU for 16 days, and then I went to Shepherd Center for a month. Had a lot of challenges. My main disabilities are all in my brain. My processing speed. I was DSL, now I'm dial-up, which back in the day, you guys probably don't know, where you had to connect your internet with a phone line, and it took forever. Anyways, but luckily, through my faith, through the love of my family, I'm able to make forward motion and still be able to do my career as a singer-songwriter. And that's it.
My name is Alex. I'm a T9. I got injured October 5th, 2009, 12:01 a.m. Reason why I remember the times is because my mother told me nothing good happens after midnight, which is true. So I ended up going with my homeboy to the gas station that was up the street. Me thinking, okay, we just going up the street. I don't need to put on my seatbelt. We come back. He lose control of the car. We end up hitting a tree and a telephone pole. I end up with my lung collapsed. I had fractured ribs. I fractured my spine. So, when you're in a car, no matter if you're going up the street, whatever, you buckle up, no matter what. I don't care even if you just parking like in a garage or something, buckle up. It's always helps.
Hey guys, I'm Sarah. I'm a recreation therapist at the Shepherd Center. I've been there for 6 years. There's a couple different parts of my job. I try and sneak the fun into therapy. So I'm working on what PT and OT are doing, but maybe instead of just working on raising your arms up, well, let's do some boxing on the Wii and make it a little bit more fun. I take patients out in the community, so kind of getting used to life in a wheelchair. Everything from going to Braves games to where do I sit in the movie theater, how do I pay for myself if I can't use my hands to hold my money. We go through all that stuff. And then the other part of what I do is getting you back to all the things that you love doing. So whether it's swimming or riding four-wheelers, going hunting, going fishing, anything under the sun that you like to do, I will figure out a way to try and get you back doing those things.
Hey guys, my name is Pranjal. I'm a senior at a high school in Orlando. I lived in Ohio pretty much my entire life. My junior year, moved to Orlando. And after my junior year was over, the summer going into my senior year, I went back to Ohio because my parents wanted to sell the house, and I wanted to just catch up with everybody and stuff like that. So yeah, I was there for 8 days. And on the night of the 8th day, the next morning, we were supposed to go back home and go back to Orlando, whatever. So my mom called me a lot, and she was like, you should come home and all this kind of stuff. And I was like, no, I'm gonna hang out with my friends. It's my final night and all this kind of stuff. So I hung out with my friend, and it was around 12:30 or something like that. And we were around 2 miles away from his house, and we're going 110 miles an hour. And he swerved off the road. The left turn came up, and he swerved off. He braked as soon as the turn came up, and resulting since he braked really hard, my face hit the dashboard. I knocked some teeth out, and then the car flipped, and I flew out the back window, and I broke my C6 vertebrae. And when I broke my C6 vertebrae, it went through my spinal cord, it punctured it, and it came back out, and that left me paralyzed from here down, so I can't feel anything like that, and I can't move anything, something like that. So yeah, buckle up.
I'm Kathy. I'm the physical therapist, one of the physical therapists at Shepherd. I get to work with some of these guys, which is great. My job is really to get them moving again. When Pranjal, just for example, when Pranjal first came in, teaching him how to get out of bed, get into the wheelchair, how to push the chair, how to get off the floor when he falls. So those are the kinds of things that I do. With Gavin, I had to teach him how to use the wheelchair, the sip and puff chair. So I get to do all those kinds of things. If somebody does have leg movement, I definitely get to teach them how to walk again. So it could be a variety of different injuries and different things that I get to do.
It was August 1st of last year, and me and my buddies were going camping on the lake, so we were all pretty drunk, and I decided to jump off my pontoon boat,
Jump or dive.
dive into the lake, and I guess just hit it wrong, and I was paralyzed. Then my buddy pulled me out of the lake, and I couldn't talk or breathe, so I was trying to tell him I couldn't breathe, and he thought I was just kidding, so he dropped me back in. He threw me back in the water, and then they pulled me back out again, and I passed out, and I woke up in the ICU with a tube down my throat. So I'm a C4 animal on event, so
What's your name, by the way?
my name's Gavin.
Oh, okay. Good. I failed to.
That's about it.
All of you guys bend your head forward and reach back here and find the bone in your neck. It's down a little bit farther than you think, that pokes out more than any other bone does. When you feel that, you know you're on C7. So Pranjal's injury is a tad bit above that. Gavin's injury is quite a bit above that. And Alex's injury is quite a bit below that. Okay? All right. Let's come to Molly.
Hey guys, my name is Molly. I was a student at Auburn University, and I went head-on with a pickup truck on my way back to school. Well, the truck won the war. It had a few dents and scrapes on it. My car was like a pancake. I injured my brain as a result, and I had to relearn how to do everything, like walking and talking, and I'm still relearning after 5 years how to do many things. The hardest part was relearning how to swallow. I had to put these little shocker things on my throat to kind of retaught the brain how to swallow, and I had to eat baby food, like ground up food, and my mom and dad were so kind to me. They got me my favorite Mexican dishes, and they're like, here's your quesadilla. I was like, that quesadilla is not so good ground up. Anyways, besides all that, I graduated Auburn in 2011, and please keep trying. You guys, I beg you to, no matter the circumstances, just keep on trying through everything.
My name is Ruth Ann, and I'm an occupational therapist at Shepherd. I work mainly with our patients who have had brain injuries, but I've also worked on the spinal cord side. But my job is to help people with their everyday tasks. So if it's getting dressed from a wheelchair or getting dressed with only using one arm, getting in and out of the shower, using the restroom, doing things around the house and doing your chores, like taking the trash out, or sometimes we have young moms who are our patients, so helping them relearn how to take care of their kids now that they have a disability. That's one of the fun things to do, and getting people back to driving. I also help people with their vision and with getting strength back in their arms and hands.
Hi, my name is Brandy. I'm a case manager at the Shepherd Center. I've been there for about 10 years, and my background is in counseling. I'm a rehab counselor. Our case managers are normally counselors or social workers or nurses, and basically our job is to help bridge the gap from hospital to home for the patients and their families. So I work with the patients and families as far as equipment needs, because most of them, or all of them, normally don't need a wheelchair before they come to the hospital. So I work with the families on what appropriate mode of mobility they'll need when they go home, so wheelchairs, what kind of car or transportation they'll get from the hospital to home, as well as working with them on outpatient therapy, and I do all the insurance work in the background, so making sure that there is a funding source behind the patient and the family member and helping them bridge the gap from hospital to home.
So you guys have a bit of a background on everybody, and I want you to kind of pay attention to brain injury and spinal cord injury doesn't care what your race is, doesn't care what your gender is, doesn't care how old you are. So it can happen to anybody. Sometimes it's by no fault of your own. You're driving home and somebody gets you from behind. Sometimes it's by a choice that you make. And part of our reason for having these classes with you guys and coming here to speak to you is you can come visit us anytime you want. I'll arrange that for you. I don't want to see you as a patient, though. I never want to see you as a patient. So the whole thing is, what can we do to help you make better choices so you're not doing this kind of stuff, okay? How many of you guys have been in a car with somebody who's texting while they're driving? Oh, ow. How many of you feel strong enough that you would say something to somebody who's texting and driving? Do they listen? No. So you go, is it somebody in your family who's doing this? You go home tonight and you talk to them about what you've seen. Now none of these guys happen to have that incident, but we've had numerous over the years. That's gone way up. Those are preventable types of accidents that can happen. So, and think again about all those things that how many of you guys took a shower this morning? Some of them didn't. Some of them did not. Remind me not to be near you. Did you do it by yourself or did somebody help you? You did it by yourself? Did you get yourself dressed? Please tell me you brush your teeth. Yes. By yourself? Yes. Okay, so these things, you don't even think about this kind of stuff anymore, right? You just do it. So these kinds of injuries have a devastating impact on how you function every day. I'm not just talking about you're playing basketball and lacrosse and cheerleading and all that stuff. This is everyday stuff. You guys take notes in class? Unfortunately. They don't give you PowerPoint, huh? And you guys have assignments that you have to read? Two of these people can speak to how difficult that can be at times, to be able to challenge your brain to do that. So, is there a question that some of you have that you're dying to ask any one of these people up here?
Mr. Billy, can you walk and like stuff like that? Do you have like any more trouble?
Do I need to talk into this? Oh, yeah. A lot of my disabilities are here, like processing speed. Like I can walk, like I can do a lot of things, but it does take a lot more time for me to focus on tasks. You can ask my wife in terms of doing my chores. But most of mine are just all, like I actually went to the doctor yesterday because I'm having focus problems and behavioral problems.
Your brain drives everything. That's the car, okay? But your spinal cord is like the highway. And so if you damage your brain, you're damaging the piece that starts everything. If you damage your spinal cord, you're damaging the way that the information gets there. And if you damage both, that makes it even that much more difficult. So you have Billy, who's actually has a brain injury, and Molly, who has a brain injury. But it's very different. So, Billy, can you just stroll down this line and go back? That's it. All right. Looks like there's nothing wrong with Billy, right? Looks all good. Unless he said and told you guys what he just did about here, you would never know, right? So, Ruth Ann, can you help us? Molly's going to get up. Molly also has a brain injury, but look how different they present themselves. See the difference? Brain injury. Same thing, very different results. And if you listen to Billy speak and you listen to Molly speak, there's obviously a difference, right? Being able to take in the information and process it and bring it back out again. Okay?
If you're paralyzed from your chest down, how can you like move your arms and bend forward and stuff?
If you're paralyzed from the chest down, how can you move forward and bend your arms? All right, you spinal cord folks, answer the question.
All right, well, it's different for me and him because he has a back injury and I have a neck injury. Whenever like I sit up, I usually keep one hand here so I don't fall forward because I don't have any ab control or anything like that. So like if I were to like go forward,
Let's try something.
I'd just fall.
Bring your arms
just like
out in
that.
front. Catch him if he goes. Bring your arms out in front. Straight out.
Like straight out?
Straight out.
Dude, I'll fall immediately.
No, you won't.
That will.
He's got no trunk movement. You guys bring your arms out. Where do you go? Nowhere.
So yeah.
Part of her question also was, why do your arms work? So can you answer that?
Well, I
This
guess.
shows you how much he learned when he was at Shepherd.
I'm like, I
No.
can't wait to-
No. Well, the whole thing with my arms is I can feel all my arms besides like this area right here. It's completely numb. I guess it's just the way like the part that my spinal cord is like affected at. Like my entire left hand, like my left side of my body was affected way more than my right, and my left hand is just 10 times more weaker than my right, and it's just like, yeah.
Like I told you how Billy and Molly are different? Well, all three of the guys with spinal cord injury are different. And it depends on where in the cord and how much damage. Because when we think of the word quadriplegic, we think somebody's totally paralyzed, right? If you learn that in the class. But all that means is some kind of impairment. Quad means 4, in 4 extremities. But it doesn't necessarily mean total impairment. Whereas Alex is considered what? Paraplegic, because he's got impairment in 2 of his extremities. But everybody is different.
If you guys get your middle finger, close it. See, look how messed up this is.
Put it on your
Like, put it on your knee?
Your desk or your knee or something.
No, like do this. This is cool. Like actually
Like
do
this.
it. Let's go. Like do it.
Are
Put
you
it
doing
on
this?
your lap, and then try to move your ring finger up. That's what it feels like to be paralyzed.
You got to tuck that.
Like
Tuck your
this,
middle
guys,
finger.
on your desk. Drop your birdie finger down. Put these 3 here. Got it?
And
Try
then
to pick
putting
up
your ring
that
finger
third
up.
finger. Try to pick up your ring finger.
See, you can't do it.
That's a good description.
Is that cool or what?
My name is Daniel, and this has to do for Molly and Gavin. How long did it take for you guys for speaking to come back to normal?
The first couple months, my voice sounded really airy. And it still doesn't sound the same as it did, but it's pretty much normal now. So, not too long. Oh, I just have to wait for a breath. That's why I'm pausing. I have to wait for another breath.
So it's no different. When we talk, do we talk when we're breathing in, or do we talk when we're breathing out? Out. So when you go to say a sentence, and your sentence is done, you go to the next sentence, you take a breath. He's doing the same thing, only it's a little more obvious. He waits for that ventilator to give him a breath, and then he speaks. Molly's different.
At first, I could not talk at all, and then I was kind of like a whisper, and I got this substance injected in my vocal cords, and it's supposed to make me louder. Now, I'm not screaming, but I am louder, and I've been through so much speech therapy. Like, it was so raspy at first, and it's a little bit better, but it's still got work to go.
So our speech therapist, Hannah, is going to add something to maybe help make that make a little more sense.
Okay, so everybody put your fingers just right up here on your throat, okay? And I want you to make a sound like a snake, like sss. Okay, you don't feel anything, do you? Okay, I want you to make a zzz sound like a bee, like bzzz. Do you feel the vibration? Okay, that's your vocal cords moving and working when you make the zzz sound. So to kind of add a little bit to what Gavin was saying, what happens is where Gavin has his vent attached is below where his vocal cords are. It's below where you feel the vibration. So he has to wait to get a puff of air from his ventilator in order for it to make his vocal cords move so that he'll be able to talk. So then in Molly's situation, and what happens with a lot of folks is sometimes one of your vocal cords stops working after you've had an injury. And so your vocal cords essentially look like this, and so they open and close when you talk. So if one of them stops, the other one's trying really hard to move, but they're not opening and closing really well because they're not touching each other. So they can't make that bzzz sound. So that's why Molly had something injected into one of them to kind of fatten it up to make it easier for them to open and close. Does that make sense? Yeah? Okay.
How was it for you guys finding out what your injury was and like if it was incomplete or complete?
Man, when I first found out, I was shocked because I didn't think it was gonna happen to me. Cause I don't even like be in a car like that. Like I walk a lot. Like I used to always walk, like everywhere. I didn't care where. Let's walk. That's like my first thing. So it was like just knowing that and knowing like the one thing that I always did was like taken away. I was just like, wow. And it's like it's not like movies. It's not like TV shows where you're paralyzed and then all of a sudden you're up and walking. It's not like that. Like I'm still going through, and I mean I'm incomplete, so I always got a chance to walk again. So that always gives me hope.
And how many years out is it now, Alex? I can't remember. 3 years out. And you still, the physical part of the therapy may be done, but you're still trying to incorporate and adjust to everything because each one of these people have lived their lives longer without their spinal cord injury or their brain injury than they've lived with them.
When I woke up, well, actually, before I even woke up, the doctor went to my mom and they told him that I was paralyzed from my neck down, and that I didn't have any movement and I wasn't gonna have any feeling or anything like that below my neck. But like after my surgery, they fused some stuff together in my neck. I slowly, like my left arm could go up and down, and they told me that I was incomplete at first, and then like later on I came to Shepherd and they did some test stuff like that. Then they told me I was complete. Then I went back home and they're like, "Oh, you're incomplete." So I mean, technically I'm complete, but I mean I don't really focus on that kind of stuff because I mean the first thing they told me was, "Oh, you're gonna be paralyzed from the neck down." So I mean, I guess if you just work at it, there's certain, like I'm not saying you're gonna start walking, but if you just like keep on going, it will get better. Like it's not like you wake up and you're done. Like I had to, like for my once again like my arm, I couldn't even like pick up like a glass and drink. I had to like get someone to get a straw and put it in my mouth, stuff like that. So I mean I just worked at it pretty much. So yeah.
And the thing before Gavin speaks is sometimes you get support from each other because Gavin and Pranjal were in at the same time. And so if you're also working with other people who are going through similar things, you at least have somebody to relate to on a certain level.
When I found out I was complete, it was sort of a shock, but I was kind of had a lot of painkillers and everything, so I wasn't all there. But I just try to keep high spirits and help everybody out. like when I was at Shepherd, I try to keep everybody up. So you just can't get yourself down and stay down, because it's just that much harder to get back up. So that's pretty much it.
It'll beat you if you let it, or you can run it.
Well, I was in a coma, so I don't really remember the first couple days, but I always think to myself, well, what's next? Like, I went from a wheelchair to a walker to a cane, to now I'm trying to get rid of that cane still. It's been 3 years since I've been on it, and it still is bothersome, and I hate it. But my arm hasn't seen so much good results. It does nothing except sit there and stare at people. But yeah, I don't really remember the first couple days. So.
But I have an interesting perspective. I'd like to kind of put a twist on this. I wonder if Todd would come stand right here. Put you on the spot, Todd, sorry. You don't even have to come up to stage. If you can just stand here. Todd is Gavin's father. How many of you guys have parents? How many of you got, well, I never know. Some people have grandparents or aunts and uncles or whoever, okay? How many of you guys think your parents would be pretty devastated if something like this happened to you? So let's hear what it's like from a parent, what that first announcement was like. Sorry, I should have given you warning.
Yeah, it's and I'm Todd, and it's it's very rough because your parents see you as their future, what they get to see you grow as and do. And Gavin was, he was a all-star wrestler. He could do just about anything, and then you see your child who's can't do anything at all. It tears you down. It really does. But at the same time, my son's still there. Gavin's still there. He's still there from the head up. So, which is why we love him anyway. That's why your parents love you, not because you can run or jump or, do anything. That's why your parents love you. So that was still there. So that made it very easy, or a lot easier for me to push forward and go on, because every day I get to wake up, see his smile, and he died that day. So I wouldn't have had that opportunity. So we're thankful for everything that we get, and we're happy with everything we get. If we don't get anything more, that's cool, because we're happy with what we got. If we do, it's just a bonus. So, but
that's awesome. Awesome. I'm going to put yet another little twist on this, thanks to Pranjal. Haley, can you come up here for a second? Haley is Pranjal's girlfriend. And so, since we're kind of on that line there, I'm curious, what's it like to date a guy that uses a wheelchair?
It's definitely not the traditional type of holding hands and strolling down like a street, because he needs both hands to wheel down something. But I don't know, I don't think you guys should be standoffish to people in a wheelchair if you guys would have the opportunity to find someone that you do enjoy being with in a wheelchair, just because they're normal people. They don't have crazy issues that you wouldn't be able to deal with, so I guess.
We just know Pranjal's crazy because he's crazy. It has nothing to do with his injury. He's just crazy. Hi there. Hopefully you've been learning information and you have a little more knowledge about people with spinal cord injury and brain injury and what it is to live with these types of injuries, as well as getting some information about people who are professionals in this area, what they do and what their educational backgrounds are. Most importantly, what we hope is that you've learned some ideas and gained some knowledge in injury prevention so that a spinal cord injury and a brain injury won't happen to you.